I'd like to introduce pharmacist Jeff from the United States. Thank you for joining me, Jeff.
Thank you for having me.
Could you tell me how you compound your LDN?
Well, we actually compound it in numerous ways. We make capsules is the form that we use most. We use it from 1.5 to 4.5 milligrams, and we compound it in half milligram increments. We have some people that are very sensitive and can do 2 but not 2.5 or 3, and then we also make a liquid where people can titrate up from a low dose to a higher dose. We do topical low dose naltrexone too.
I was asked the other day for the cream what it's actually made from.
Well, we actually have a special base that we use that has pomegranate oil and emu oil and a lot of good oils that are lipid soluble so that it'll absorb readily through the skin. It's all good, healthy stuff.
And when did you first hear about LDN?
Probably, I want to say 7 years ago. Doing a lot of research on my youngest son who's autistic, and Jackie McCandless, I think I was at a conference, and she was speaking on low dose naltrexone. So that was the first I heard of it, and that was, Jackie McCandless has done a lot of research in the United States with low dose naltrexone.
And what would you say, condition-wise, your patients take LDN for?
What conditions? Well, I have a few that have MS. I have one that has Crohn's disease. I have multiple patients who have Lyme disease, and multiple patients that are on the autistic spectrum disorder.
And what kind of results are these people finding?
I've had one with the MS who has actually seen not a regression but no progression. And she had very rapid progressive MS, and it sort of stopped it in its tracks. We've had people with autism that have gotten much more language, and a lot of times their immune systems are so compromised in Lyme that we found that it's actually helped with the immune response, and also the anti-inflammatory response for in Lyme disease. We've had a lot of effect with that.
And do many people stop taking it, have you noticed?
I probably have about, maybe 15-20% who can't tolerate it or don't get a result that they want. Maybe it's closer to 30% if you put that all together. I have a few that don't tolerate it well. And then we've had some that, just did not respond to it how they thought that they would respond.
You said that your son takes LDN for autism. I know you had said previously that you'd made lifestyle changes and other treatments as well. Could you tell us what else you used to complement the LDN?
Well, some of the biggest things we did was get rid of casein and gluten, and within 3 weeks of getting rid of casein and gluten, he started saying his first words.
Wow.
And he progressed with that. We also have used antifungals, which were amazing. He started speaking phrases after he went on antifungals and got rid of a lot of the yeast in his GI tract. We've used Valtrex, that we were able to get some stuff, and then we used a lot of nutritional supplements. We also, with non-medicinal modalities, we used some ABA therapy and a lot of other educational therapies. And he's right now almost on grade level at 11 years old.
He's done remarkably well, hasn't he? Remarkably well.
We're very blessed. Very blessed. He's done well.
And getting back to LDN, how would you summarize LDN from your experience?
It's another piece of the pie to help treating these patients. It's I've got people with fibromyalgia who's been on multiple medications, narcotics that have been able to come off of. Of course, we stopped the narcotics before we would start the LDN because it would put them in withdrawal. We've had, like I said, my patient with MS who's had no progression. I've had autistic patients that have gained speech. So it's amazing. When I first heard about it, I was very skeptical. And the more research I did and the more I've used it, I've become a big believer in LDN.
Well, thank you very much for sharing your experience with us.
My pleasure. Thank you for having me.